Welcome back to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine that we put together at the Virginia Institute for Public Policy so that you can go off and stop over at somebody's trick-or-treat party, and when they start telling you about how great Elizabeth Warren's plan is, you have things like, what do they used to call them when we were kids? Facts and information to share, but always have a good time while doing it, as we do here. Our next guest, and again, you will find all of these interviews archived on our YouTube channel. Look up Freedom and Prosperity Radio on YouTube, is the co-founder of the Center for Medicine in the Public Interest, Peter Pitts. Peter, thank you for joining us this week on Freedom and Prosperity Radio. How are you, sir?
Oh, my pleasure. Thank you very much. I'm fine. How about yourself?
I'm doing great, although the organization you founded has always befuddled me, because one would think there's this oath that doctors take that would indicate that there shouldn't be medicine that isn't in the public interest, but I guess that's where we've landed these days, haven't we?
Well, there certainly is politics and policy that I don't think is in the public interest, and doctors and other healthcare professionals and patients, unfortunately, get caught in that vortex.
So, talk to us a little bit. Having seen it, you were an FDA commissioner for many years before you started the center, correct?
Well, associate commissioner, but thanks for the promotion.
Well, I guess
I've got the scars to prove it too.
the word commissioner by any name is so. What were you seeing from the other end of the horse, as it were, that it made you say somebody needs to be in here trying to help folks navigate this morass so that they can get back to just being a doctor-patient in the doctor-patient relationship?
The problem is, there's a lot of bloviating about how to improve healthcare, and most of it is completely wrong and politically motivated. And as you know, politicians hate complicated answers. They want simple answers like quote-unquote drugs from Canada or Medicare for all or universal coverage. Mm-hmm. And those are just sound bites. They're meaningless. And when you dig into the policies from any politician that says these sorts of things, you recognize they're entirely hollow. And when you look at the facts, it becomes scary, because these so-called solutions actually make the problems worse. I have a new book out called Common Sense Healthcare for Common Sense Americans, Parenthetically, and Presidential Candidates. And my goal here is to inject some common sense, some facts into this conversation.
Well, and talk about how we got off the place. I guess it's always been my feeling that if you're going to heal an injury, your best idea is to figure out how the injury happened, and then you can work on healing it, or an illness, to continue in the medical metaphor. How did we wind up so convincingly fooled into a place where there's more insurance actuarials and lawyers in our relationship with our doctors than patients and doctors?
Well, healthcare is a complicated proposition, but at the end of the day, there's only one goal, and that goal is to enhance therapeutic outcomes for patients, period. Mm-hmm. That's it. The problem is that politicians and pundits and kind of beltway experts, so to speak, have hijacked the conversation and tried to find good guys and bad guys, because that's what makes headlines, and the media loves it. And, the current bad guy is the pharmaceutical industry because, quote-unquote, drug prices are too high. But when you tell people, on the first hand, the drug spend in the U.S. represents 11% of our national health care expense. People can't believe it. That's not 90% or 70%. You read the paper, you think that's what it was. And then people say, well, why are drugs so much more expensive here than in Europe? And then you tell them, well, 90% of the drugs in the U.S. are generic drugs. And those are less expensive in the U.S. than they are in Canada or Europe. People look at you like you've got three heads. So it's kind of knocking down these falsehoods so you can actually get to workable solutions, like, for example, allowing insurance companies to sell policies across state lines so costs can come down, allowing people to buy insurance policies they feel best suits their needs rather than dictates from the government. That Uncle Sam MD isn't really that great of an idea. Mm-hmm. That in Europe, for example, the fastest growing area of healthcare is private insurance versus government insurance. And people look at you, and there's a total cognitive disconnect. This is not what they're hearing in the media. It's not what they're hearing from politicians. It's not what they're hearing at barbecues and Thanksgiving dinners. And breaking through this wall of nonsense to inject some facts and focus on making patients healthier faster is absent, and that's got to change.
Well, take us, because I can recall when the idea of health care or health insurance came out, the only thing available was what we now refer to as catastrophic. And it was so inexpensive that the restaurant I was working for as a night manager was able to pick up the freight on it and said, Joe, we're just going to give you, and here's your card, have a nice day. And if you need to go to the hospital, this is what you show them when you get there. And if I needed to go to a doctor, I wrote him a check for a few bucks. I think it was $25, something. I'm dating myself and how long ago it was, just for an office visit checkup. And I didn't need all the forms and all the paperwork, nor did the doctor need a dozen folks working just in the compliance department of his simple general practitioner's office. And then we say, gee, we can't imagine why rural health care is going away and those kind of things. Was it the insurance industry first, or did the insurance companies start and then realize that this would be a whole lot easier if we had governmental mandates behind what we were doing, and then people wouldn't ask, gee, do we really need this?
Well, I think what it is, and this is a dialectic over time too, like you mentioned, it's a real deterioration of people accepting personal responsibility for their actions and certainly for their own health. I believe if people want to buy an insurance policy that only covers catastrophic care, and I think we should do that, by the way, they should be able to do that. But, the government has said, no, every insurance policy has to have these 87 things in it. Otherwise, we're not going to deem it, allowable. That's ridiculous. I was in government when we introduced the Medicare Part D drug benefit for seniors.
Mm-hmm. Okay.
And people said, senior citizens, they can't possibly make their own choices. That's ridiculous. It'll go downhill so fast, everybody will make mistakes. And you know what? It's been a huge success. Seniors actually can make good decisions, and not some people don't. And that's human nature. But you have to allow people to make their own choices. And now that's the same proposition relative to buying private insurance. Let people buy the insurance policy they see fit. There are a lot of people in Congress who say, no, people can't buy their own insurance policies. They don't know what they're doing. You know what? I have trust the American public that if they can figure out what's best for themselves. And if they make a mistake, then you deal with the consequences. Government is not the solution on this. Trust me.
It strikes me that it would probably cost us pennies on the dollar to embark on a campaign to make sure Americans did know, the realities of healthcare insurance, or just to make sure we had educated consumers, rather than actually delving into this morass of quasi-government private partnerships like the Affordable Care Act.
That's exactly right. And there are other options too, like health sharing, which is not insurance, but it's an old-fashioned kind of neighbor helping neighbor, sharing medical expenses, and it's legal and it's available in all 50 states. It's very affordable and people like it. It's not right for everybody, but nothing's right for everybody. What you want to do is create a system where options flourish and people can make their own choices. And part of that is, for example, not allowing. So people talk about a Medicare option, right?
Yeah.
And I think that's interesting. But if you want to have that, that means the government can recognize the economy of scale across the country, allow insurance companies to sell insurance policies across state lines too, so they can be less expensive and broaden choice. It's not an either or. Putting everything in the column of Uncle Sam MD, Medicare for all, universal coverage is absurd. And then of course this tremendous cost relative to taxation, which of course Elizabeth Warren doesn't want to talk about.
No.
But it exists, and when you have government health care, what you also have, as you have in Europe and Canada, is rationing. And no one seems to be brave enough to say, listen, I want a government system, and yes, there will be rationing, let's discuss it. That's the third rail, and it's incredibly dishonest.
Well, and even during the great days, we had Paul Krugman say, well, of course, you're going to have somebody say that this care isn't going to be necessary or efficient. And so, sure, we have those panels, but I wouldn't call them death panels. And it became parsing became the spectator sport around the Affordable Care Act, Peter. But the rationing of it in a free society, I worry on a deeper scale on many different things that we're going into this the discussion of democratic capitalism and things like that, where sure, you can have a business if we all vote to approve your business, then you can start one, and that kind of thing really is anathema to a free republic.
Well, the beauty of the 100,000 Democratic debates is that some of these candidates are actually saying what they think.
Yeah.
And many Americans are finding it abhorrent. And so we all can vote. And if people want to say, listen, I'm willing to pay higher taxes and I'm willing to accept rationing and kind of average care versus great care, let them vote for it. But we have to be honest. You have to call it what it is, rather than something like you can't call healthcare rationing a cotton candy stand, because that's not what it is. It's healthcare rationing, and it happens in Europe and it happens in Canada. And if we want that, we should vote for it. If we don't, we should understand what we do want, which is a system based on options, which is driven by a free market, and that's what we've got now, and it works. We need to make it better.
Peter Pitts is on with us. He's the co-founder of the Center for Medicine in the Public Interest, new book out, Common Sense Healthcare for Common Sense Americans and presidential candidates. And it's available, I guess, if people went to CMPI online, cmpi.org, they can find the book, or should they go to Amazon? Or
they can go to our website, or they can go to Amazon, or they can just send me a psychic message, and I'll send them a copy.
Okay. Now, let me circle back to something that is, we talk about health savings accounts. I still look at those and think, gosh, if you could just treat them like a 401k and you can hold on to them for your whole life, we wouldn't even need Medicare anymore, because people would start saving into these health savings accounts in their 20s when they're young and healthy, and by the time they're 64, 65, there's millions of dollars saved up in these things, and heck, they could probably gift some health care payments to their kids. But none of that is going to help if the insurance companies hold this stranglehold on the provider. And it's always bothered me that we went after Standard Oil, but Standard Oil didn't make you join a club first before you bought their oil. The medical industry, especially the medical insurance industry, has this amazing ability to make people not see the monopolistic practices of we control all the providers and we control all the customers. So the providers have to do what we tell them and only serve the people we tell them, or we kick them out and cut off 99% of their business.
The middleman here is invisible, and that's really, I think, where the problem starts. The middlemen, the prescription benefit managers and the like, suck out of the healthcare system every year $33 billion. That goes right to their bottom line to augment their stock price. These are all big public companies. So when a middleman negotiates with a manufacturer, some 20, 30, 40, sometimes 50%, and yet the copays go up, what's wrong with this picture? If you're getting this huge discount, a large part of that should be passed along to the patient, because when people say, you kind of quote unquote, my drugs are too expensive, we're hearing that a lot. What they mean is, since the overwhelming majority of Americans have health insurance, what they mean is my copay is too expensive. And that's the insurance company, that's the prescription benefit manager, that's not the manufacturer, that's not the drug manufacturer. So pointing at quote unquote big pharma, allows these people to remain invisible.
Yeah.
And they've been very successful at remaining invisible, and that's got to change too. Because at the end of the day, these people the middlemen provide zero therapeutic value. They don't help a single patient get better.
Nope.
They either need to become part of the solution, or they need to get out of the way.
And they're very good at hiding in plain sight as well, Peter. So what are some of the policy prescriptions that you come up with? I don't want to give away the whole book, but in broad brushstrokes, because it sounds like you've got quite a bit of detail in here. But things, the president seems to get it in a lot of places, but then he says he's going to negotiate with Canada to get the prescription drug prices down by bringing in their low-cost versions of the same prescriptions that are expensive here, which is ludicrous. And I have no background in economics. And then I talked to a few economists, and they said, no, that's the wrong thing to do as well. So even the guys who seem to be doing it right in most cases are falling afield in other places. So what are some of the ideas that we could foment to create a better healthcare system in the future?
Well, I think in order to be okay, great. Let's be positive. Let's talk about solutions. So, firstly, allow insurance companies to sell policies across state lines. Recognize the economy of scale. 1, 2, allow insurance companies to sell more different types of programs. So, rather than burdening them with the Obamacare litany of coverage issues that most people don't want. Let there be thinner packages. Just catastrophic care, for example, for younger people. We've clearly failed to tax people into buying insurance. We knew that wasn't going to work, and it didn't work. Incentivize them by giving them more affordable plans, for example. That's another good option. 3, let people know that there are non-traditional insurance opportunities out there, like health sharing. It gives you what you need. It's less expensive. It's a good old-fashioned neighbor helping neighbor. Help promote that, as well as promote the various Obamacare, platinum, gold and silver and bronze, and second place and third place, and best in show type of propositions. And then we need to both have incentives and sticks. We're very good at giving people carrots. We need to have some sticks there as well. If you don't do the right thing, your programs are going to cost more. We need to let people know that if they don't do the right thing, they're going to hear about it. I mean, we've done a very good job penalizing people who smoke cigarettes, as we should, I think. There are other areas where we need to focus on that as well. Obesity comes to mind, or overconsumption of sugar. I'm not saying take away people's ability to buy it. I'm simply saying, hey, if you want to drink sugary sodas, that's your privilege. We're going to tax it, and that tax is going to go towards paying for, indigent care, for example. I think there are lots of ways to involve the people. I think we need to inject a strong dose from a solutions perspective here of making people feel responsible for their own health, rather than accessing the system once they're already sick and expecting that somebody else is going to pay for it. And then lastly, we have to be loud and aggressive about knocking down really bad ideas, like you mentioned, drugs from Canada. Bad idea, unsafe, doesn't save money, and Canada has said they're not interested in participating in such a proposition. Their health minister recently met with Alex Azar, the Health and Human Services Secretary, and basically told him as much. So the president gets good advice. Sometimes he follows it, sometimes he doesn't. But I think he has a good nose for what people want. And what the president understands is that when people say my drugs are too expensive, it means their copays are too expensive, and Washington can help change that proposition. So I think we focus on the needs of the patient versus kind of quote-unquote bending the curve or these long mathematical equations with Greek letters in it. We can actually get something done.
So one of the things I was kind of dancing around before, and if I had a non-traditional form of paying, whether it be just my money or a health sharing account, many medical practitioners are restricted from seeing me. I have in the past known which doctors would take cash payments, but you had to be somebody they had referred to them so that you weren't going to narc them out to the insurance companies that would cut them out of the programs. You mentioned the middlemen before, but how do we protect, I guess, not whistleblowers, but the stethoscope blowers that will actually see people outside of the traditional HMOs, Blue Cross Blue Shield networks, because I think that grip on that percentage of the healthcare consumer population, if you want to call them that, is dangerous as well. Is there anything we can do about that, Peter?
Yeah, I think the answer to that question is the answer to the broader questions. We really have to embrace good old traditional free market values. I mean, my wife went to the dermatologist the other day and asked how much a visit was. They were like, what type of insurance do you have? And she says, no, I want to know how much it costs. And I went, gee, I don't know. So that's got to change. We've got to go back to a kind of a simple, transactional, free market proposition.
But can we protect doctors that do that from being kicked out of network? Like, doctors, I know one urologist, he signed in to a health insurance program, and his agreement with the insurance company says in this restraint of trade sounding proviso that he will not see anyone from outside of this network. And I just feel like that's got to fail FTC oversight somewhere.
It does. I agree. And the other problem is that, insurance is regulated 52 ways. Every state, Puerto Rico, District of Columbia. If we can somehow do away with every insurance company having to redo things 52 ways to Sunday, literally, I think we can free the doctors as well.
So actually, in one case, a federalist view, is not necessarily the best, because selling across state lines, is good for the insurance companies to, compete with one another. But right now, they're competing with the states as well, is what I'm getting from you in that. That's
right, and competition drives down cost and increases option. That's the beauty of capitalism.
Bernie Sanders said in one of his debates, and you mentioned this earlier, Peter, that bless all these 12 Democrats dancing, or at least hearing some of the things. His argument for Medicare for all is that then insurance companies would have to compete with the government. I can't think of a lot of instances where the government loses in that kind of competition, because if they need more money to compete against somebody, they just go and tap into the taxpayer.
That's right. It's also like saying, we'll compete, we'll negotiate with you, but if you don't give us your price, we're taking away your patent. Like that's like that's like a 5-year-old arguing with their parents about how much candy they can have.
Right. And
hey, I have to. You have to phone in a couple of minutes. So
no, we're finishing up here.
What else can we talk about?
No. I just once again, the people can get the book on Amazon at Amazon.com. It is called Common Sense Healthcare for Common Sense Americans and Presidential Candidates. Pick it up there. I appreciate. Will you be doing a book tour at all with us, Peter? Before we let you go,
I'm putting it together now for the new year, so I'll let you know when I'm in town.
Oh, absolutely. We want to have you here in Virginia and for a book signing. Thank you so much for joining us this week, sir.
My pleasure. Thank you so much. Good conversation.
Thank you, sir. Absolutely. And he raises a great point about the idea of negotiating over how much Halloween candy you can take home with you, and say, well, I don't know. I may not be able to cut the grass for you, Dad, if you don't let me have more of my Halloween candy. It's like negotiating with the insurance industry as well. Well, thank you all for being on the receiving end and enjoying the program this week. Again, you can find out more about us at tertiumquids.org, TERTIUMQUIDS. I thought I knew how to spell it, and as well as on our YouTube channel. Until next week, I'm Joe Thomas. For all of us here at the Virginia Institute for Public Policy, so long, and thanks for all the fish.